So your dog's not walking on the hind legs, it's holding one up. What could it be? Let's go over a few things and make sure that you check out these things if your dog's limping on the hind leg. Of course, if it's really painful, yelping, it's got a big cut, it's losing blood, take it right to the vet. But if you just want to say, gee whiz, Dr. Greg's going to help me check a couple of things. Let's check it out and see what we can see. Ready? Mm-hmm. First, you want to check the paw. Check the nails to make sure that none of them are cracked. There's no blood, no swelling around the nail bed, like right there. Look in between the toes. Check for burrs and rocks and cuts and rashes. And on the foot itself, make sure the pads aren't blistered. Look in between them for rocks and rashes. If there's some rash, you might try a little bit of cortisone ointment. You might try an aspirin. Dosages for those things are at my website, Dog Dish Diet. Then, if you don't see anything in the foot, squeeze the toes. See if any of the toes are hurt. Squeeze and feel along the leg. Make sure the bones are okay in the foot. In the hock, flex and extend it. See if that's okay. So make sure there's no breaks or dislocations. The stifle, same thing. That's the knee joint. You flex and extend it. Feeling all the while up the leg. And the same thing with the hip. Flex and extend it. And you can even press on the hip a little bit, and you can see if that hurts. So we've kind of checked the bones, the paw, the nails, the pads, in between the pads, the joints, and the bones, and then check the muscles. If you squeeze, sometimes you'll, like this dog, if this dog's a little tranquilized, and Isabel, if you could focus in on her, see? So there's a painful muscle right in here that hurts. So that's what's hurting her, and I'll quit squeezing because it hurts. So that's how you check the leg. In order to make sure that there's nothing inside the leg, sometimes I take x-rays. So let's look at the x-ray and see what it shows. This is an x-ray of the pelvis. This is the spine, and this is the short tail. These are the hip joints. There's no arthritis in the hip joints, and that's good. So that's what I wanted to check for, to make sure the muscles that I felt, the painful muscles, didn't have any referred pain coming down from the hip. You can even see there's a little bit more whiteness here in that muscle. Could be a sign and possibly the hint of swelling. So this is where the problem is right in here. But usually we don't use x-rays for that, we usually just feel. But you can also say the hip joints are good, and the bone all the way along is good. There's no breaks in it. And down here is fine too. And this other leg's fine, and down here is fine. So those are the kind of things we look at when we check a dog for lameness, and we look at the x-rays. We check for any fractures, any dislocations, and any arthritis. So thanks for watching. And check out my website, Dog Dish Diet.